Okay, this video is about anxiety, insomnia, and benzodiazepines. Benzodiazepines are they're abbreviated BZDs. They're a commonly used sedation medication for short medical procedures like interventional radiology procedures, colonoscopy, minor diagnostic procedures. And they're also used though for major surgeries, for anesthesia, including general anesthesia potentially. They're well tolerated for that purpose. I had to go for colonoscopy about 15 years ago, probably a little more than that. And I refused sedation just because I was scared of the memory effect. I didn't even want to take a chance with one dose, okay? You know, my memory is like one of the few things I got going for me. I didn't want to risk it. I was a lacto-vegetarian at that time. Now I'm a vegan, and my risk of colon cancer is so low, I wouldn't even go for colonoscopy. The risk of a complication is higher than my risk of cancer. Okay, the best book on the subject is this one, same old book, Brain Disabling Treatments in Psychiatry by Bragan. I have all the page numbers from his book in here. If you're like serious about this, you know, my YouTube channel is for serious people who really want to learn, and you know, so you might have a kid or a family member being considered for these drugs. So I'll give you the real scoop fast, and if you want to look it up more, you got the page numbers in the paper in this, and I got some other book references and whatnot as well. Okay, Bragan says that BZDs are possibly the most brain disabling of all psych meds. And people also will say, well, gee, you know, the guy was psychotic, schizophrenic, they got a neuroleptic, and so, you know, maybe it had to be done, he needed that severe of a medicine. But a lot of these anxiety patients are just a little bit anxious. They're not that sick, but after these benzodiazepines get through with them, man, they got a lot of problems, very many of them. And the reason the benzodiazepines reduce anxiety is because they shut down the brain. They activate GABA, gamma-aminobutyric acid, which is the most important inhibitory neurotransmitter in the brain. You can think of glutamate as a light switch that turns the brain on, and then GABA is the neurotransmitter that turns the brain off. And a lot of these other neurotransmitters, some of this serotonin, dopamine, norepinephrine stuff, they're modulators of glutamate elevating the brain activity and GABA lowering the brain activity. Okay, but they're all kind of connected. That's another important point too. We'll come back to that in other future lectures. Okay, so yeah, that's a good metaphor. The glutamate is like the accelerator. Accelerator on a car, go faster, all right? Whereas GABA is like the brake to shut the brain off, shut it down. So glutamate increases cytoplasm calcium, which is positively charged, and it's the calcium that makes secondary processes run inside of a neuron. Whereas what GABA does is it raises the amount of chloride, which is a negatively charged ion, the opposite of calcium, the opposite of sodium. It's negatively charged. It's a halogen. So it hyperpolarizes the neuron, making its resting membrane potential more negative. Let's say make it more like negative 75 instead of negative 65. And by being more negatively charged inside, the neuron's then less likely to fire an action potential. GABA receptors are super common. They're present on at least 30% of the brain neurons. The GABA type A receptors are present throughout the brain, especially in the limbic system, but throughout the brain. And when benzodiazepine dosage goes up, the brain goes progressively from relaxation to sleepy, somnolent to a coma. Okay, and there's always respiratory depression, meaning a lack of breathing and oxygenation when a person's going down towards the coma level. That's why they got to intubate the patient with general anesthesia, and that's also why these often cause death with suicide attempts. They're very dangerous medications. The GABA A and the GABA B receptors have been shown to be involved in memory formation with the glutamate neurotransmitter system. So glutamate is a key neurotransmitter for LTP, long-term potentiation for forming memories. But GABA modulates it. GABA affects it. Okay, that's a big deal. There's been a whole bunch of experiments with ketamine and turning things on and off quickly, showing that these GABA receptors are very important also for memory. So you can't just block one neurotransmitter in the brain. That's an important point. According to Bragan, there is no psychiatric drug that just blocks one little thing for one little disease. First of all, the diseases in psychiatry are largely made up. I mean, don't get me wrong, there's patients who do have major psychiatric problems. That is definitely true. But the DSM is just a bunch of descriptive categories, and a lot of them are completely made up just to sell more drugs, okay? So the GABA A receptors are what are called ligand-gated, meaning that they bind to the receptor and then it opens up the chloride channel and an ion comes in. So that's very fast. So something that happens fast is going to be based on an ion channel. And they're also called ionotropic receptors. Okay, and by the way, alcohol, barbiturates, and some anti-seizure medicines, they all block or they all activate GABA receptors. So they all have an inhibitory effect on the central nervous system. GABA B receptors are a little different. They're the slow ones. Those are called metabotropics. And what those do is they have to run through a secondary messenger system. They're often called G protein coupled. So GABA A receptors are the main ones for benzodiazepine activity. But just to give you a sense of how complicated the brain is, there's at least 19 subtypes of GABA A receptors. And I don't even know how many GABA Bs. No one fully understands it. All right? The papers are just coming out about its effects on memory. So what I'm trying to say is, the psychiatrists are messing around with a system far more complex than they can understand, and they're damaging it. You can prove the damage done by psychiatric drugs, especially benzodiazepines, but these other ones as well. It's easy to prove major damage done by these drugs, but they don't understand them well enough to get any type of long-term benefit. A short-term benefit has been shown here or there, different situations, depending on what your goal is, okay? But long-term, man, it's amazing how damaging all these psychiatric drugs are. Okay, continuing on. The GABA receptors are so ubiquitous in the brain. We talked about them being present in at least 30% of neurons, that there's no way you could get a specific treatment of anxiety, okay? And anxiety is due to a bunch of different things, so you're not going to treat just one little isolated neurotransmitter in one little group of neurons and get the result you want. You're shutting off the brain in general. And when you chronically shut off the brain in general, you cause major problems. Okay, my own personal philosophy about health is you want to mimic natural conditions as much as you can to live like Adam and Eve, but with the benefit of plumbing and indoor heating. And that works. That's the healthiest people in the world. When you start trying to trick Mother Nature, you might get away with it short term, okay? But you try to trick Mother Nature on a prolonged basis, it doesn't work. You get crappy outcomes, you know? Okay, Bregan says basically benzodiazepine is part of a brain disabling mechanism, okay? It puts neurons out of commission. It shuts down the brain. That's why it can be used for anesthesia, because it shuts down the brain. And it'll cause memory impairment, like the patient won't remember the procedure they had. Well, you know what? You keep messing with that memory system every day with these drugs, you can permanently destroy it, and these drugs will cause dementia. Typically, they're called minor tranquilizers in comparison with the neuroleptics, which are called major tranquilizers. Those are the drugs used for schizophrenia. Benzodiazepines are commonly prescribed for treatment of anxiety and for treatment of insomnia. It's really the same type of drugs. One will have different length of half-life activity. They're also sometimes used to block the stimulating effects of SSRIs. So you can see how you get polypharmacy here. Patient takes an SSRI for depression, then they get over agitated, so they go, oh, we'll take a benzodiazepine. Now they're on two medicines that are both potentially going to destroy their memory. Okay, other side effects of benzodiazepines, sleepiness, and the danger is when you come off it, you can get terrible rebound. Spellbinding. Spellbinding means that the patient will be neurologically deteriorating. You know, friends and family will say, look, you can't remember anything. You said the same thing to me twice yesterday, okay? And it's like the Dunning-Kruger effect. Dunning-Kruger effect is whereby when a person is incompetent at something, they're too incompetent to judge their own incompetence. But family and friends can see the neurologic deterioration in these patients, obviously. Memory impairment, a major side effect. That's why I wouldn't take even one dose for colonoscopy. I was scared of that. They can develop a paranoid psychosis. Their confusion, runs a spectrum. It can progress to delirium, acute agitated confusion, and to permanent dementia. That's a big deal, permanent dementia. People used to think these drugs had no side effects. The old Rolling Stones song of the 1960s, Mother's Little Helper. Man, they can produce dementia. A lot of research has been done to show brain atrophy caused by these drugs, reduced cerebral blood flow. They're also addictive. People thought initially they weren't addictive. No, they're clearly proven to be addictive with major withdrawal symptoms. They can also cause sort of paradoxical agitated behavior and lead to depression, suicide, homicide, and death. So some of these people acting all crazy in public, it's not just because of the SSRIs, it's also because of these benzodiazepines. The author Bregan has seen some people, fall into these patterns after only 1 or 2 doses of benzodiazepines. So even just that one dose potentially can trigger a major reaction. They're really sort of not exactly the same, but in a similar ballpark as SSRIs for suicidal behavior, homicidal behavior. They're bad, okay? They got a tremendous overlap with alcohol. Look at these effects. Sleepiness, insomnia. The alcoholic might fall asleep but wake up in the middle of the night. Addiction, confusion, violent behavior, bad stuff. So the long-term effects, basically, the brain tries to fight the drug. So it's causing too much GABA in the synapse, so the brain will decrease the postsynaptic GABA receptor. So you decrease the receptors to try to decrease the GABA effect. And also maybe the presynaptic neuron will make less GABA, again trying to diminish the effect of the drug. But the problem is that a person reaches a point when this is done chronically, taking this drug chronically, those brain neurons might not be able to return back to their normal way. They can't revert back to normal. And that can mean the patient can never come off the drug. Some people have tried for over a year to wean themselves off, and they can't. That is a frightening thing. So they're losing their memory, they're going insane, but they can't come off the drug. It's just like being a spectator at one's own destruction, okay? And these patients would say things like, when I try to withdraw the drug, I feel like I'm going insane, all kinds of major reactions, including psychotic reactions, really bad. Patients become disabled and can never work again after having problems with some of these drugs. Okay, another thing I'll mention is this book here by this lady, Grace Jackson. Her book is called Drug-Induced Dementia. She's a real smart psychiatrist lady, and she is good at going through the research and going through the imaging research. Some of that's been done showing the brain atrophy, increased ex-vacuole dilation of the cerebral ventricles due to brain shrinkage, brain atrophy. She also goes through the animal studies showing the histology of neuronal loss. So she's a good complement to the other books I showed there. And they're causing brain damage, loss of neurons in the hippocampus, your memory center, abnormal changes in the brain, plasma membrane lipids called gangliosides. It's all bad. Okay, Robert Whittaker, I like him. He's, he's a better writer than these doctors. He knows a lot of the history. He's a bright guy. He's got a bunch of online videos, Robert Whittaker. His book right here, Anatomy of an Epidemic, is a good book. Goes through the history of the benzodiazepines and the problems with them, and his video lectures are all good as well. And he talks about how the benzos were the best-selling drugs in the Western world from about 1968 to 1981. So they were real common. But at the same time, mental hospital admissions, emergency room visits for psychiatric problems took off. So the more psychiatric pills people take, the worse they get. It's rather shocking, but that is true. And if you study it, you will see that. Freud in 1895 said female anxiety is mostly due to unconscious repression of sexual desires. Yeah, right. That's BS. In my experience, I'm talking to a lot of people, men are about 100 times more interested in sex than women. And women will say things like, she wants to know what she's going to get for it. Men will say things like, what do I have to give in order to get it? Okay, that she's much more desired than he is. And, I could say other things. I've talked to men and women all my life. I'm an old guy. And that gives women a big advantage in relationships. You bet it does. Anyways, Whittaker provides a lot of historical background on benzodiazepines. He goes through all out of the research, and one of the key points he makes over and over again is that the benzos are much, much more dangerous with long-term use than short-term use. Long-term use is a disaster. I would never recommend that unless you can't withdraw because of the side effects. So he calls it the benzo trap because of the failure of the receptors to come back to normal, and it's a disaster. Okay, and that's all I got on benzodiazepines. Bad news, benzodiazepines. I would try to avoid them as much as I could, other than perhaps in a short procedure that I really needed if I did. But I'm a low-fat vegan. I don't need any procedures.